Deep static forehead lines? I'm 28 and have deep lines, wrinkles on my forehead. It's been this way some 13 to 14 years. I think it's genetic because most of my family have the same. But I'm noticing they seem deeper even when my forehead is relaxed. I was thinking of Botox for this, but since the lines are there when the muscles are relaxed, I don't think Botox alone will work. I was wondering if it is possible to use dermal fillers to fill in the lines, and then Botox to relax the muscles too. Also, what filler would be best for this?
Thank you for your question. You're 28 years old and you state that you have these forehead lines since you're about 13 to 14 years old, and that you're concerned, although this is a family trait and this is something you recognize, that your lines are present even when your forehead is relaxed. And then you describe in very good detail your concerns that Botox may not be adequate because the lines are still present. And so you're asking, is there a potential role for a filler to help these horizontal lines improve? Well, I can certainly give you some guidance in this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon practicing in Manhattan and Long Island for over 20 years. And certainly Botox was one of the first our specialty was one of the first to use Botox, so I've been helping patients with Botox since 1993. So that being said, I want to help you first understand some terminology. And this terminology is as follows: dynamic versus static wrinkles. Dynamic wrinkles are wrinkles that occur when there's activation of muscle. And in the forehead lines that you're describing, the muscle is called the frontalis muscle. So when that muscle contracts, the forehead lines form. Then there's static wrinkles. Static wrinkles are wrinkles that are there even when there's no active contraction of a muscle. So what you're concerned about is that even with Botox, which you know relaxes muscles, that the lines are still there. So you're dealing with both a dynamic and static line situation. In our practice, we do commonly address both issues concurrently in a lot of people. A common strategy would be to use Botox to relax muscle, a filler such as Restylane to help add volume and not just the horizontal lines on the forehead, and as well as use something called platelet-rich plasma to stimulate collagen to build back the collagen that's lost in the dermis, which is why these static lines become so obvious. Think of the dermis as a foundation that keeps the skin smooth. And if there's a fault in that foundation, then you'd want to try to restore the strength of that foundation. But I would say that in your situation, as a younger person whose skin is relatively thick, that there's a challenge in a couple of ways. First is you don't want your forehead to be completely paralyzed, because if your forehead is completely paralyzed as a younger male, it's going to be very obvious, and people will be able to say that you have Botox. In my practice, for someone like yourself, I would do a limited amount of Botox and let the muscles still work, but allow a baseline tone to be diminished so that there's less creasing of the skin. Now, it's been my observation that with consistent use of Botox, those lines can soften up significantly without doing the injectable, because as someone who's younger, you'll probably be fine as long as the lines soften and don't continue to get deeper. Now, if after a certain period of time you still want to improve the static element of those lines, then you can consider these other options. I think it's important to also understand that it is unlikely that you'll be able to erase the lines completely. This is a genetic family trait, and at a young age developing them, I think management has certain value, but you also have to think of the cost and the logistics and time that it would take to address these lines. And you may want to simplify things and start with Botox first, or do something like Botox and PRP or platelet-rich plasma. So I think it's important that you meet with qualified, experienced physicians who routinely perform these procedures, learn about your options, think about the risks and benefits and expenses. And what's nice about these procedures is they're pretty low risk. They're not surgical procedures. If you don't like something, well, whether it's Botox or a filler, it goes away. And PRP, platelet-rich plasma, is your own blood, so it's a very low risk from that end as well. So I hope that was helpful. I wish you the best of luck, and thank you for your question.